how much does it cost for me to go on Medicare, and which is the best route for me to address my healthcare needs? What's up, friends? Rob here, the Medicare Minister with Agape Insurance and Financial Group in North Mississippi. And these two questions are some of the most popular questions we get asked all the time here at Agape. Now, when it comes to Medicare, there are two main routes that you can go with. One is to stay on original Medicare with a Medicare Supplement and prescription drug plan, as well as any other ancillary plan that you may need to address your healthcare needs. Option number two is what's known as a Medicare Advantage plan or Part C plan. And the most simple way I can put it is that Medicare is just simply outsourcing your healthcare to a specific carrier. And these benefits include your Part A and Part B, as well as your prescription drug plan in most cases, as well as ancillary benefits such as dental, vision, hearing, and so on. Okay, so let's talk about these two main options real quickly. Now, if you're going to stay on original Medicare, that's your red, white, and blue card. You have your Part A, which is your hospital insurance, or sometimes referred to as your inpatient. You have your medical insurance, your Part B, sometimes referred to as your outpatient. And that Part B only pays 80% of your medical bills. Therefore, you need to have a Medicare Supplement or a Medigap plan to cover that other 20%. Now, the most popular plan out there is a Plan G, and I'm going to be talking more about that here in just a few minutes. And that Plan G covers your Part A deductible, but it does not cover your Part B annual deductible, which for 2024 is going to be going up to $240. So therefore, it means that if I was to go in the hospital tonight and I had my original Medicare, my red, white, and blue, and I had my Medigap or Medicare Supplement plan, my Medicare would pay $80, my supplement would pay the other $20, minus Part B deductible, which again for 2024 is going up to $240. When it comes to a Medicare Advantage plan, a Medicare Advantage plan is a managed care plan. It's a network-based plan. So the freedom that you have on your original Medicare to go to pretty much any doctor, any hospital, any provider, now I lose that freedom because that specific carriers like Aetna, Humana, United Healthcare, just to name a few, are now in charge of your Medicare benefits, and you must go to providers within their network if you have what's known as an HMO. It just simply means it's a very restricted network-based plan. Unless it's an emergency, I cannot go outside of that network. Now, if I get a Medicare Advantage plan that's a PPO network, which we strongly recommend here at Agape, then that allows me to go in and out of network. I just simply pay a higher price if I was to go out of the network. But once again, when I go on these Part C plans, I'm getting my medical, I'm getting my prescription drug plan benefit, and I'm getting all these other ancillary benefits that I would not get if I was on original Medicare. So these are things that you have to really weigh out in regards to what are my healthcare needs, what's my past medical history, because when I first go on Medicare, I am guaranteed a Medicare Supplement plan, which means I'm not subject to any underwriting and my medical history doesn't come into play in regards to my acceptance. So if I'm going to stay on original Medicare with the supplement, then I need to go ahead and do that the very first time. So that way down the road, I won't have to worry about underwriting or being possibly denied. For some people that may be healthier, they may not want to spend the separate premium for the Medigap or the prescription drug plan. And so therefore, they may want to take a look at a Part C or Medicare Advantage plan. And the reason for that is because they're generally zero premium or very low premiums, and they're an all-in-one plan. For some of our more healthy people, they may choose this route. And then we have a lot of clients that we work with that are just on a very limited budget or just don't really have any budget at all, but they don't want to just be stranded on with red, white, and blue only. Then a Part C plan can also be a very good fit. Now, I am not in the school of thought that you see a lot of people on YouTube talk about how bad Medicare Advantage plans are. Although they can be a bad situation for some Medicare beneficiaries, I truly believe it's super important that you get with a Medicare broker who represents multiple companies on both the original Medicare side as well as the Part C or Medicare Advantage side. And that way they break down all the different nuances and they break down everything for you so you have a full understanding, especially when it comes to the Medicare Advantage side. Because of them being network-based, providers, you must check all your providers. And then you also want to be very thorough on both sides, the Medicare Supplement and prescription drug side, as well as the MAPD side, Medicare Advantage that is, with your medicines, because it could cost you hundreds and even thousands of dollars. Additionally, with Medicare Advantage plans, you have copays that are built into the program, copays to see specialists and for outpatient surgery and for inpatient, for ambulance, and more. So you definitely want to be aware of these copayments as well as their max out-of-pocket that you are responsible for on an annual basis. This just simply means the most that I could pay in one calendar year for medical expenses on this particular Medicare Advantage plan. The other thing you want to be aware of is that the Medicare Advantage plan, as I said earlier, you don't have the freedom that you have on the Medicare Supplement side. And what I simply mean by that is many of the services that you may require are going to need a prior authorization. So just because your doctor says you need something done on the Medicare Advantage side, it doesn't mean that you will get it done, because it's going to have to be approved many times from the Medicare Advantage carrier. So there's pros and cons to each side, but the Medicare, original Medicare, Medicare Supplement with a prescription drug plan is, in my opinion, the most comprehensive insurance that you can get if you're going on Medicare. Once again, if I could put it this way, it's going to require a little bit more skin in the game to get that, in my opinion, what's known as better, or what I would call better coverage. So what I've done here on the screen, and we'll put a little graph here for you to see, is that on the screen, the one thing you want to be aware of is some of the costs. So it's going to be different in different parts of the country. So I'm not going to try to break it down exactly, but just to give you a little bit of something to think about and kind of somewhat of a comparison. Here's what we have to look at when it comes to on original Medicare side. Here's what we have to look forward to if we decide to go the original Medicare route. So if we do original Medicare with a Medigap or Medicare Supplement and Part D plan, we got our Part A premium, which is $0. We have a $1,600 deductible, which we could be subject to multiple times per year. We also have a Part B premium, which for 2024 is going to be $174.70. And then we have an annual deductible on the Part B side of $240. Now, the good news is if I have a Medicare Supplement, also known as a Medigap plan, it's going to take care of that Part A deductible for me. But it's not going to take care of that Part B premium, that $174.70, nor is it going to cover that Part B deductible, which is going to be $240 for 2024. However, it will cover the 20% that's left over from Medicare. And once again, it doesn't matter what the limit is, it's going to cover that for me. Now, let's look at the most popular Medicare Supplement plan. That is the Plan G. And in my area, the Plan G starts around $100, but across the country, it's going to be $100 and it's going to go up from there. Once again, this is why it's important that you work with a seasoned Medicare broker / advisor. And by the way, if you do not have someone to work with, please call the number on the screen. Our number's also in the video description, or you can fill out the contact form below. And myself or one of our Medicare advisors would be more than happy to help you at no cost or no obligation to you. So the Plan G is starting around $100 and going up from there. And remember, a Plan G is a Plan G. There's no better company, but you don't want to pay more for something that with Company B that's going to work the exact same way with Company A. So let's say $100 plus. Then we have our Part D plan in 2024. The lowest Part D plan is going to be 50 cents, and it's going to go up to over $100 depending on which carrier, which company works best for your medication needs. right? And then also you have to be concerned about any ancillary plan. What if you need dental? What if you need vision? What if you have some hearing challenges that you need to address? Those are going to be additional costs as well. Now, let's look over at the Medicare Advantage side. You'll see the graph here on the screen. And on the Medicare Advantage side, one of the biggest pros about going this direction is they are generally zero or lower premium plan. Include extra benefits such as dental, vision, gym memberships, hearing, over-the-counter cards, and more. So a lot of Medicare beneficiaries that have these needs that need to be addressed, it's at no additional cost to them if they go this route. Now, the other thing we have to be concerned about when we're looking at a cost comparison is the copays that I could pay to go to my regular doctor, as well as my specialist, as well as I have outpatient surgery copays, ambulance copays, inpatient stay copays, ER visit copays. So those are all things that I need to take a look at, as well as that max out-of-pocket amount. In my area, that max out-of-pocket starts at $5,900. So when I'm looking at comparing the cost, I need to think about all of these things that all these different nuances and dynamics in these particular Medicare Advantage plans. So I get asked this question all the time: which is the best route for me to go? And I'm going to answer it the way that I answer it to everyone, and that is, it really depends on your specific budget and healthcare needs. No, I sound like a broken record, but once again, this is why it's very important that you get with a seasoned Medicare advisor / broker that can work through all of this with you to find out which is the best route for you. You can simply do that by calling the number on the screen or filling out the contact form below. And myself or one of our advisors would be more than happy to help you. Once again, this does not cost you anything, but it could cost you hundreds, even thousands of dollars if you get it wrong. And as we get ready to finish out today, if you are getting value out of this video, please take a moment to like, comment, subscribe. This just allows us to help more Medicare beneficiaries like yourself. So I've tried to break down just a little bit of what to look forward to when it comes to the cost of me going on Medicare. The last question that I'll address real quickly is, when people go on Medicare Advantage plans, sometimes they think, or they'll ask me, can I get out of paying that Part B premium? And the answer is no. Whatever option 1 or option 2 that I decide, I have to pay the Part B premium, which once again is $174.70 in 2024, unless I qualify for what's known as the Medicare Savings Program. And that just simply means that I qualify to get some form of Medicaid. Then and only then could I qualify to get that Part B premium back. And for some of you watching today, you may fall into that income bracket where that could be a possibility for you. Once again, call the number on the screen, fill out the contact form, and we can advise you and help you apply for that at no cost to you. Well, I hope you got tons of value out of this video today, and God bless you guys, and we'll see you on the next video.